We'll get started here in a few minutes, everybody. I think we're waiting on a couple more people, but we'll get started here in another minute. All right. I think most of you know me. My name is Ken Seal. I'm the apprenticeship training representative for the Western region of the U.S., and I'll let Bernie introduce himself here in a minute. I'm pretty sure that everybody on the phone knows each other, so I'm going to forego the introduction at this time because there's like 24 of us on the phone, and this being a 6-hour course and us doing it in 2 days at 4 hours, we want to make sure that we use that time to get through the material that we need to get through. Start out, the IFTI has been working on doing a train-the-trainer with COVID-19 and ICRA, and we put this together with the assistance of Bernie Mazzullo, which is the industrial hygienist, which will introduce himself in a minute. Because of the need that we're hearing in the workforce, we've been being told that a lot of companies are putting on COVID-19 officers. We'll talk about that also. And what that is they're making their safety plans up, which includes awareness training of COVID-19. And then on the ICRA side, which is designed for healthcare facilities, is actually becoming more of a need now because ICRA is found in the CFR 29 and is now being asked for a lot more in some other facilities. So ICRA is becoming important too. So this was a request from the affiliates, you guys, to put on a train-the-trainer so you could in turn around and train the members. So this course was put together. I appreciate your participation. And now there's 26 on the phone. So I'm going to go ahead and just go straight on to Bernie. It'll be me and Bernie kind of hosting this class, and with the assistance of the administrator. So Bernie.
Good morning, everybody. Thank you all for joining us. This is, as Ken said, our second a rendition of doing this train-the-trainer. Just a little bit about myself. I'm an industrial hygienist, a certified industrial hygienist. I've been practicing for 25 years. I mainly only serve labor. I barely do little private industry work. My heart is with labor. My father was a 45-year veteran union carpenter after he got out of World War II, so I grew up with labor issues always discussed around the dinner table, including health and safety issues. My father did work a couple of jobs in New England where there were some fatalities over his career, which I heard about. So anyway, so that's what I do, industrial hygiene. If anybody is interested in learning more about it, let me know, because I'm always trying to promote it and get some more folks into the field, because there's not many of me left. I'm a dying breed. Most of my mentors are retiring. So with that said, so Ken mentioned we're going to do this train-the-trainer in 4 hours. It is designed as a 8-hour in-person class or a 6-hour online class. And so it was a little, tedious trying to put this together with enough interactive activities that you could do both live on screen like this and also in seats once we start doing face-to-face training again, and that will happen. It's important, though, that you try to stick to the 6 hours for the CPWR grant counting purposes, because they were able to get some supplemental funding through their NIH HAZWOPER grant. For doing COVID-19 specifically. So that's why it's actually got to stay in the title of this training as well. So we got to make sure that we meet those minimum criteria for them. And you'll notice that there are 3 topics in this training: infectious disease, COVID-19, and then ICRA. And the reason why we decided to change it up a bit, because really ICRA is a method for reducing the risk to all types of infectious diseases, and also to keep certain populations safe when you're doing construction. And COVID-19 is simply an infectious disease, but it's a very prominent, important one right now. And so at some point, once this pandemic dies down, you know, COVID-19 module is just going to shrink down. It's going to become one part of the infectious disease module. The infectious disease module, you could basically teach that by itself as its own, you know, module. You could easily make a, you know, 2, even up to a 4-hour class with it if you had face-to-face stuff, as long as you included enough activities and then made it pertinent to the type of, you know, worker population or public health population that you're, you know, dealing with, whether it be like one of the Job Corps or something like that, or some other kind of community group. So it does have a lot of versatility. And as Ken said, we're going to try to go through this and highlight all the new stuff and talk about aspects about delivering it as a trainer. And if you've got any questions, you know, we've got some of the IFTI folks helping us out here, thankfully, because I'm not a Zoom expert. Although, Ken, I don't know, I think you should get a certificate in Zoom expertise, because what I've been understanding is you've been coming pretty far understanding how to operate this thing.
Yeah,
So
just a note on what you said, Bernie. If you guys if you have some questions as we're going through, you can ask Bernie if it's directly on the topic that we're at. But if you have a question, please put it in the chat. I'll be monitoring the chat, and I'll bring the questions up to Bernie as I'm also watching the time, so we make sure that we get through the material that we need to get through.
Yeah, thanks, Ken. Just a little bit more as we start to get into this. So again, it's designed so that you can deliver it face-to-face, 8-hour class, or online in 6 hours. And we'll try to, you know, delineate how you could do and change up some of the activities depending upon what platform you're trying to do this in. And, you know, so I'm an industrial hygienist, but I had the benefit of getting my master's degree from a program which had as a cornerstone adult education, and a step further, popular education. If folks know what pop ed is, it's basically training delivered to any targeted group that is going to affect change, whether that's change within a community or change within a workplace. So I really value training right from the get-go. I've trained somewhere over 12,000 different workers now in my career. I used to track it, but I lost count. Especially, I usually have to track it if I'm doing grant work and stuff like that. But I don't think you can get more bang for your buck, except maybe doing elimination controls or engineering controls, than you can with training. Because the phrase that we have in the National Institute of Environmental Health Sciences grant program is empowerment of workers through training. So, I mean, it's the whole teach a person to fish thing, right? As opposed to giving them a few fish to chow down just for a day. I don't think you can get any better bang for your buck here. And specifically with COVID-19, you've got a real opportunity here to affect your members and their protection against COVID-19, their families. And if they start to spread the good news, you know, maybe they can affect other people as well. Because I'm not going to make any mistake, we're going to probably see a second peak during this first wave of the pandemic. Yes, some of it is going to be attributed to the protests that are going on, but we already started to see an incline within 20 states based on how those states decided to reopen. And that's important to understand. And there's been plenty of examples of construction jobs having to shut down after they reopened because of spikes in workers and workers' families with COVID-19. With that said, we're going to have a second wave at some point. Could be in the late fall, could be in the winter. That's going to likely be tied together with, unfortunately, seasonal flu. So we're going to get double hit. So you're going to have a great opportunity to really make a big impact on a lot of your members' lives, not just in their workplace, but also how they're going to conduct themselves and protect themselves and their families outside of that. So with that said, let's buckle up and get through this. I'd like to say I'm wearing a wig, but I think I need a haircut.
Before you get started, Bernie, so everybody knows, after we finish the course on Friday, Bernie and I will do a few more adjustments. We did a course last Thursday and Friday. We do a little bit more adjustments after we hear your feedback on this course. And once we get your feedback, we'll make the necessary adjustments, and then we'll download the material onto the LMS for your folks' access.
Yeah, thanks, Ken. More than likely, not more than likely, certainly, I'm going to update some of the stuff in the COVID-19. It was my intent to try to get to that this week, but we had some more pressing matters for the IUPAT with some other things that I did this week. So I'll make sure that I attend to that probably over the weekend, the beginning of next week, and get that out as soon as I can. So Ken mentioned that we're going to, skip introductions and stuff, but if you come in with a question or something like that, just so I know, because I only know a couple people still, just let me know who you are and maybe where you're calling from or hailing from. All right, next slide, please. So the goals of this course are to provide, the necessary training to develop an understanding of infectious diseases, as I mentioned, the COVID-19 pandemic, and then infectious control risk assessment procedures. And this is all at the awareness level. If you want to actually go and implement some ICRA controls and things like that, you're going to want to have a little bit more robust class. And it is the intent of the IFTI to develop a hands-on ICRA worker training course as well after this. Next slide. So class participatory rules. So even though this is online, it's not a webinar, it's a class. We expect participation. You should want to do that with your folks that you're going to run through it as well. We got a bunch of activities that we came up with. They work for both, as you're going to see, doing it online. They're going to use a mix of like poll questions, breakout rooms that we're going to cover. And you're also going to be able to deliver these if you're face-to-face. And again, I'll mention when we go through them, you're going to want to mix them up a little bit so that you can have some more interaction between your group, maybe use some more resources that you might have access to either at your training center, et cetera. But they work for both spots. So you want to make sure that your mic is on mute unless you're starting to chime in with a question, and use the chat box. What we did last class, I think, is we ended up saving all the chat questions, and somehow we answered some of those at the end, closing out, and we're incorporating any feedback that you got when we revise this. So that's important. Next slide. This training is going to be delivered into 3 sections. So today, we're going to cover infectious disease awareness and COVID-19, and I'm going to focus probably more on the infectious disease part since it's a brand new module. And I think last time we ended off somewhere midway between COVID-19, which gave us enough time to get through the ICRA class. We did cut through a few slides that were not changed. And if you've taken the ICRA course before under CPWR, those things would have been the same. But anywhere where there's brand new material or something that's been changed, I'm going to make sure that we stop and point it out. And again, this is all at the awareness level for these things. Next slide. So now we're going to get into, first off, infectious disease. So we're going to want participants to be able to define what an infectious disease is, explain a chain of transmission, list 2 infectious diseases that could affect them at work or their family. And then we've got some other goals that we want to make sure that we get through. And I made sure that I included some definitions of language that go a little bit farther than what I think I would normally do if there wasn't a pandemic. Because one of the things that this pandemic has done, besides harm a lot of us, is it really unearthed a lot of disparities that we've got within our communities and on the job site. How many people here, and think about this, found that your job site wasn't ready to handle the pandemic because they didn't have some basic things that they should have already had in place, like a respiratory protection program, fit testing of respirators, proper HAZCOM training, things like that. So we've been finding that there's a lot of things that should have been going on to protect us from the everyday hazards already, and then we get to this pandemic and it kind of pulled the curtain back on those things. So I guess the silver lining for this is it's been an opportunity to see that we've got to certainly address some things going forward, not just for a pandemic, but for day-to-day operation of our health and safety on job sites. So I've included some, language like what a pandemic, epidemic is, et cetera. Next slide. So history of infectious diseases, they've been around forever. Folks are probably really familiar with, the Black Plague or the bubonic plague, the Black Death that occurred in the Middle Ages, wiped out about 1/3 of the population in Europe. Measles destroyed South American Aztec civilization, and we've had viruses that wiped out native North American tribes because again, there's no immunity to this stuff if you haven't gone through it. And so, just coming over, even doing trading, you would bring over diseases back in the colonial periods here, and it would wipe out tribes. Next slide. How about over the last 100 years? So, 1918 obviously has gotten some press recently, right? Because this was our last widespread sort of global pandemic, which affected and killed a lot of people. 1981, the ongoing HIV/AIDS pandemic, we're still in the midst of that. SARS, West African Ebola, I participated during that in 2013 and 16. I was doing work with the USW, the steelworkers, because they represented a number of nurses and custodians and things like that. And I don't know if folks have saw this in the news, but there's been a few more cases of Ebola that have been popping up in Africa right now. So this has been something that we've been kind of dealing with for a while. And of course, we got, COVID-19. And since 2000, there have been 50 plus infectious disease outbreaks. And the speed of these, if you go back historically and look, from the early 1900s to now, they're picking up speed. A lot of that has to do with global warming, population density, and travel. I mean, we can get around so quickly around the globe right now. If something is out, you have an outbreak, if you're not catching everybody who might be potentially affected, those folks travel, right? That's how it came here. Next slide. There's two sort of broad categories. We have emerging infectious diseases versus re-emerging. So emerging are basically new or novel ones. So these are new outbreaks of things like COVID-19, like MERS and SARS was. So they basically happened over a short period of time. And by that, I mean, a couple decades or so. And then we've got the re-emerging diseases. These suck because we thought that we got rid of them, right? And that we've dealt with them, but lo and behold, they're coming back. Sometimes these re-emerging diseases, they're immune to antibiotics, right? And then they start to get the term superbug or something like that. Some things in the Boston area that have been re-emerging have been whooping cough and TB for me. I know that California, I think it might have been last year, you had a resurgence of, I think, measles, right? So these are things that are re-emerging, and sometimes we can swat them back down, but sometimes they're more difficult because of antibiotic resistance. Next slide. This graph says a lot. So this is global examples of emerging and re-emerging diseases just in 2017. You can see how full this map is, right? So there's a lot of stuff here, that's getting covered. We do have one oddball category in here. It's called deliberately emerging. So this was use of anthrax as bioterrorism in the US. But other than that, these are just those other two categories. There's a lot there. So you can imagine how this taxes, our medical system, especially if it's stuff we don't know how to fight. There's so much we don't know about COVID-19. I didn't read this report yet, but I got some inference to it from my spouse that the German medical community is starting to see in autopsy how this disease has been actually attacking organs. I mean, and we just thought it was a respiratory disease. So we keep adding new symptoms and methods of harm that this disease causes. So think about how our medical system has been taxed, right, in this country so far. That was one of the reasons why we were talking about flattening the curve. I've told my kids, both of them have asthma. I've got asthma. We're obviously nervous about getting it, especially if our medical system is taxed. But I told them, I said, we're all going to get it at some point. I said, I just want to make sure that when we do get it, there's plenty of beds available in the hospital for us, right? In case something like that were to get to that level, because it's going to be tricky. So when I do get it, when my family gets it, I want that curve to be flattened down to a straight line, hopefully. And we can do that by educating folks about, what's really going on about not just COVID-19, but other infectious diseases. Next slide. SARS, so severe acute respiratory syndrome. This is, you know, a fairly recent one, you know, that affected the globe. Then we got our next slide. This is MERS, so Mid-Eastern Respiratory Syndrome. This is another more recent one. So these are examples of emerging infectious diseases. Next slide. So it's important that we understand, you know, the right terminology. Just like you can imagine how important it is, you know, to educate your apprentices on the definition of different tools, different, you know, whether it be, you know, taping techniques or painting techniques. We want to make sure that we're passing on the right definitions of stuff so that we can all go on the same page. It helps us control things and it helps alleviate fear as well. So how should we define diseases? So this is one of the examples of our first group activity. And I think we've got this one set up for a poll. You could do it as a small group activity as well if you were going to do it in a classroom. So basically, our poll is, which of the following do you believe are diseases? Click all that apply. And we've got the definition up there on the slide from NIH. So let's click which one are diseases. And again, the main gist of the definition is an infectious condition that can impair normal tissue function. Actually, I'm sorry, non-infectious. Skip that. I didn't mean to say infectious yet. That's the next slide. So it's an ailment that impairs normal tissue function. And I can't remember, Ken and Nicole, how do we proceed after this? Is there like a time limit? We wait for everybody to get their poll in, or how does this work?
It'll show that everybody answered it, and then they'll pop up the poll once it's done.
Okay, thanks, man.
We'll share the results as soon as everybody's responded. Okay, we'll take another 15 seconds before we close it.
All right. So I think, why don't we keep our poll results up there, and we'll go through. So we got 100% said Ebola, yep. Broken arm, nope. Headache, nope, good. Alcoholism, we got 64%. So alcoholism is a disease. It's actually a disease in twofold. It affects us mentally and it affects us physically as well. What's an example of a physical outcome from alcoholism? There's one typical disease that always gets associated with it.
Anybody get an answer on that, or close?
Enlarged heart.
Cirrhosis of the liver.
Cirrhosis.
Yeah, cirrhosis of the liver, and also known as fatty liver. So, you know, one of the byproducts of metabolizing that, our liver produces, you know, a fat byproduct, and then we get cirrhosis. Good. A West Nile virus, good. Common cold, that's a disease. Seasonal flu, yep. Mental illness, that is a disease as well. Oh, that's a tricky one because it's not like you're walking down the street with a rash on your face, right? But a mental illness is a disease. And I'm glad to see that the IUPAT has a pretty robust mental illness and wellness program. I can't remember what it's called. What was it called, Ken? Helping Hands or something?
It is the Helping Hands website. You can go on that, and substance abuse.
Yep, good. And asthma is also a disease. It's one that you can, you know, be born not just from common occurrences, but you can have certain chemicals trigger asthma as well. And once you get it, you don't give it back. So the correct answer is all of those are diseases except a broken arm and a headache. All right. Next slide. So here's another activity. We go right in it. So now that we have an understanding of what disease is, we want to know what is a infectious disease. So an infectious disease is a disease that is caused by the invasion of a host by agents whose activities harm the host tissue, which is what the disease term is, and can be transmitted to other individuals. So there's a couple ways you can do it. The way that I have it here now is the definition is up there. You can also hide the definition on the class, right, and ask them to sort of go through this on their own and then flash it up. So this, I think we have set up for another poll. So basically, all these things on here are diseases. So now we want to put a check next to the ones that are infectious diseases. So let's get our poll up. And, you know, I created this in general terms, this activity, but if you wanted to, you know, you could either add to it or create a new activity. You know, which of the following are infectious diseases that you'd have to be concerned about at the job site, something like that. So there's a couple different ways you can play around it, but you really want to make sure that they understand what a disease is and then what an infectious disease is. All right. So we got HIV, heart disease is not. Although interesting, heart disease, it can be hereditary, so you can actually have some factors that might make it more likely for you to get heart disease, but it is not infectious. Malaria, yep. Alcoholism, again, non-infectious, but there are some hereditary markers that might make you more prone to developing alcoholism. West Nile virus is, TB is, seasonal flu is, mental illness is not, and asthma is not. Very good. All right, let's move on to the next slide. So this chain of infection, this is like the bread and butter sort of the infectious disease module. If you can get the class to understand this, it's going to go a long way, because if they understand the chain of infection, they're going to be able to better protect themselves and better understand how controls can be implemented to protect themselves from infectious diseases and those around them. We've said it a bunch of times with like discussing COVID-19. You know, infectious diseases, it's not just like you are limiting a harmful outcome from a hazard just to you or a small group of people, right? So maybe a couple people working on scaffolding, you've got a fall hazard there. It's limited, right, in scope. But infectious diseases like COVID-19, it's not just limited to affecting you or a couple of your coworkers. It could wipe out the whole job site, right? So this is something where everybody's got to understand and be on board. And the mentality of, it's just the welder's problem. I don't even work anywhere near them. I don't have to worry about breathing and welding fume. It's not the same. So we've got a couple things here. You've got a portal of exit. I should say the pathogen. You got a reservoir, portal of exit, transmission, portal of entry, and susceptible host. These things are going to continue in a cycle, and we're going to want to break that cycle, right, so that we prevent people from continuing to get infected. Next slide. So there are microorganisms. We call them pathogens up there. You can also call them infectious agents. They come in 6 forms. So bacteria, viruses, fungi, protozoa, helminths, and prions. So there's 6 different kinds. I've got the definitions up here. They all cause different types of infectious diseases. And on our next slide, we are going to do an activity with them. So here, this is one we're going to go into breakout groups, and whether it's doing an online course or if you are in face-to-face, you're going to want to be able to have students have access to some resources, as simply as, you know, the internet, their cell phone, or maybe you've got some, some hardscape like books or something like that in your classrooms that you can use. So the goal here is we're going to, each microorganism form lists one pathogen and disease. And we've got bacteria through prions. And for this train the trainer, I think we're only going to work on a couple of them. Is that correct?
That is correct.
Yes.
Each group will have 2 to work on.
Okay, so, and I think I find that in my agenda, right?
Yeah, I can actually tell you real quick, Bernie, if you like.
Sure.
So what we got here is we got, let me go to the right document here. Well, I had it downloaded. Give me 1 second, Bernie.
Sure.
I had it. Okay, so group 1, breakout room 1 is bacteria and prions. Breakout room 2, viruses and helminths. And breakout room 3, fungi and protozoa. I'm probably pronouncing that way incorrect. And breakout room 4 are prions and viruses.
Okay,
All right.
so we're gonna, you have something else to add? Okay, so we're going to break into breakout groups for about 7 minutes or so. So that's not a whole lot of time to get your activity done. It gives you enough chance to introduce each other and then work on your 2 assignments. Okay, so here we go.
The thing again.
Oh,
think it was
I can share my.
on there.
Go ahead, Donna.
It's Alice.
Oh, Alice, it says Donna on the thing.
I know it says Donna. She said she was, oh, okay, never mind. Donna's on. Got it. Thanks, Donna.
No problem. Okay, so they asked us to do activity 3. So they assigned us fungi and protozoa. So I think they gave an example. So we need to look for the sample pathogens and the disease per microorganism. So we need to search for the one assigned to us, fungi and.
Hi, Donna. Hi, Nicole, you good?
Yeah, we're good. Thanks for
Okay.
checking in.
Awesome. It's kind of fun to check in. I can bounce between rooms.
Check us out.
Hey, Alice.
Hi, guys.
Yeah, I had for viruses also was like influenza, all those 2, right? Influenza, HIV, actually Ebola, all of them are all viruses. Yeah, and for the prions, somebody had said Alzheimer's. Yeah, it affects the brain, right? It caused the brain to not function properly.
Yeah, protein. It said something about folding, proteins not folding right. So
Yeah.
brain diseases, that type of stuff.
And it says usually same as COVID, actually, it attacks the older people, right? And then that says once you have it, you have about a year normally, once you've contracted it.
And then, so that's the diseases. So what about the pathogen?
I kind of found that confusing how they said that, like how it says it here.
Yeah.
Because they kind of work together. The pathogen, and the bacteria, they kind of work together. So I didn't really understand on that sheet or on this thing here, like we're looking at what they meant by that.
Well, but for like COVID-19 would be the virus, and then the disease would be respiratory.
Oh, yeah, okay, yeah, yeah. All right.
Like like the droplets.
Yeah.
And I guess for prions, that would be, you know, brain function and so on, memory loss and so on, right?
Irregular proteins, I guess, maybe.
Yeah.
And then when you guys start conducting this training, this is kind of, you know, what the things that you would want to do with your groups, whether it's from a distance or when you're together. But this is sort of that's kind of why we walk through this, just so that on Zoom, you can set up the breakout rooms, you can jump in and check on your groups to see how they're doing and kind of appoint person to do the activity. So if somebody wants to type it in, and then when we get back together, whenever they stop, the breakout rooms, however you want to do when they share it. I don't know if we'll share it today or not, but we're ready if they want us to share it.
The buffets at Disney World, and I think those are going to be a thing of the past, at least for a little while.
I agree.
Yep.
Bernie, about 2 more minutes, okay?
All right, sounds good. We're doing pretty good.
Okay.
Yeah, so I would say, folks, for your
Either do it, you know, have them do some homework prior and then come back, or you could do, you can actually even make this into a poll if you wanted to, or a breakout room. So it just depends on how you're running that virtual class.
On the virus, is smallpox, is that what we're going to go with?
Disease?
Yeah, on the disease. What about on the pathogen? What do you guys want to go with on that?
The Ebola?
But is that a pathogen or is that a disease?
I think that.
Yeah, I think that's a disease.
Yeah.
Oh,
Are you
I think the virus itself is a pathogen.
okay?
I may be wrong.
Of the types of pathogens, the variola, that one is a type, but I don't know if we would go with that or not.
That's the only causes the smallpox.
And the disease, yeah, that's correct. The disease is actually the smallpox from the variola or the pathogen.
Hi, guys, this is Alice. About 1 more minute.
Thanks, Alice.
Thanks, Alice.
thank you.
And
Has anybody been teaching any Zoom-based or webinar-based type classes?
No, sir. We just got.
Panomosis. Thank God I'm a drywaller, not a
That's how I feel.
professor.
African, what was that?
Trypanosomosis? I don't know.
Nosomosis. Close enough.
Hey, guys, a little less than a minute, okay?
Okay, thank you.
Once
Oh, sorry, go ahead.
I said when I close the room, you'll still have about 60 seconds, so you have a little time.
Toxoplasmosis is another protozoan. If any of the females in this group have ever been pregnant, that's why they tell you not to empty the cat litter box when you're pregnant. The toxoplasmosis.
Oh, yes.
Okay, guys, I'm going to close out the meetings. You'll have about another 60 seconds to finish up.
It's almost like the Wizard of Oz. It's just this voice came out from nowhere. Behind the curtain.
they did.
We got 13 of us back now. Looks like we're getting pretty good here.
We're back, Ken.
You're back, Bernie? Everybody, it looks like everybody's back. So let's go with, let me get to my document here. Let's go with breakout room 1, bacteria and prions. What did you guys get for a pathogen and a disease?
Bacteria was pretty easy. We hit all the general ones, salmonella and staph, things like that for bacteria. We found out the prions were a lot more rare and mostly diseases you never heard of, and some of them were very serious.
Okay, excellent. Thank you very much. Breakout room 2, which is the group that I was in, viruses and helminths. I think I'm pronouncing that right, Bernie. I'm probably butchering it, but
No, that's it.
okay. Kevin?
All right. Yes. We kind of, for the virus itself, we went with the variola type of pathogen, and that actually causes smallpox. So those are our 2 for the pathogen, and the disease is smallpox. On the helminths, tapeworm, there's a multitude of different types of flukes or worms. For the tapeworm itself, schistosomiasis is what it could cause as far as the disease. So there's a multitude of different types of parasitic creatures that could cause the disease or a disease. Yeah.
Breakout room 3, fungi and protozoa. Breakout room 3. Anybody?
I guess we should have nominated a speaker, but we found a couple.
Okay.
We're looking at for protozoa. We were talking about toxoplasmosis. So if anybody's ever been pregnant or had a wife that's been pregnant, one of the recommendations is that you don't clean out a cat litter box, because the cat feces can actually host the Toxoplasma gondii parasite, which causes that disease. For fungi, we were talking about histoplasmosis is a disease caused by the histoplasma pathogen, which is found in bat and bird droppings. It says most people who breathe those spores in don't actually get sick, but those who do may have fever, cough, fatigue. We found a whole bunch out there too, lots with really hard names to pronounce, so that's why I chose to talk about those 2.
No, excellent. Good stuff there. And how about breakout room 4, prions and virus?
What were we for?
How it causes abnormalities. Oh, hang on. Yeah. Can you hear me now?
Yeah, we can hear you.
Okay. Yeah, it causes abnormalities in your brain, right? You know, the disease part of it is the Alzheimer's, right? And the effects of that are, it causes abnormalities in your brain proteins, which causes, you know, loss of brain function and so on, right? Can actually cause death in the elderly, right? Mm-hmm. As far as the, what was our other one? Viruses, perfect example is COVID-19, right? As being a respiratory illness as well. And I guess we're still learning about it, right?
Okay. Well, we'll go back to the PowerPoint slides, and Bernie, if you got any comments on what was stated, that would be fantastic.
Nope, so good job. But like I said, if you know, I think with the 6 hours, you'd be able to have probably everybody answer all of these.
And as you know, I think everybody on here is an instructor or somewhat instructor. If they're, well, all instructors, different positions, but it's really getting them to look up this stuff, and the more they look up something, the better they know it. So that's the key behind that that breakout rooms.
Yep. All right, thanks, Ken. Let's see, so our next slide here, you know, it's basically an infection results when a pathogen invades and begins growing within a host. And disease results only if and when the growth of an infection pathogen causes impaired tissue in the host. And this is important because it speaks to onset time or incubation period. So the time when you first get infected to when you start to see symptoms. And we know, like with COVID-19, a lot of people can be, propagating the disease, shedding the virus, and they don't have symptoms, and yet they're still infectious. So this kind of thing is pretty important to understand. Next slide. So virulence describes the infectious agent's aggressiveness, right? So the difference between, say, playing chess and maybe wrestling. You might have gotten a cold in your life, no problem. You can go to work without a problem, no issue, right? Maybe you get the flu one time and you can't do anything, right? You don't want to get out of bed, the joints hurt, everything hurts. So how virulent is that pathogen that is invading your body? So that's important. Next. So, again, common cold, I threw up Ebola for an example, but a little less aggressive one would be, common cold versus the flu. All right, next slide. This is important to understand. So the reproduction number, or RO, is going to tell how easily something spreads. So for an example, let's take COVID-19 there in the middle of our screen. And this is why, when this first started, people are saying, oh, it's just like the flu. No, it's not just like the flu. It's much more contagious. So the flu, seasonal flu, has an average RO of about 1.5. I picked 4 for COVID-19, and I think that this is going to be on the low side. Reports are starting to come up with RO numbers for COVID-19 of 5 to 6, but let's take 4. So what does an RO of 4 mean? It means one infected sick person with COVID-19 is going to infect 4 people. And those 4 people are going to then go and infect 4 people, etc. So if we look down towards the right of this diagram, measles, its RO is 18. So imagine that, one person can infect up to 18 people. Then those 18 people go. You'd imagine how quickly your slide would fill up with infected people, right? If you had a high RO number. So the one that we've got for COVID-19 is somewhere between 3 and 6 right now. And it looks like, maybe 5 or 6 might be what ends up getting documented. And we're not going to know for sure until this starts to come to a close and we can get all the study in. Next slide. A reservoir of a pathogen is basically the habitat where it likes to stay, grow, multiply. On the left, I've got an example of a common duct that I might see if I do an HVAC inspection. Unfortunately, it's not common to find well-maintained, clean ones, I hate to say. I got a picture of a swamp there, going hiking. Those of you who mentioned deer hunting and such, ticks are always an issue. Lyme disease is not a joke. Population, right? So you go out in a crowd, it's a good way to maybe grow an infectious disease. And I got an example there on the right of a water bubbler, for something like Legionella. So there's different reservoirs, and if you can identify reservoirs in your training center or on your work site, you're going to be able to eliminate them. For instance, the reservoir of Legionella, make sure that you don't have standing water. Make sure that your temperature for your hot water is set at 140, and make sure that you empty and clear out, drip pans and condensing units to make sure that you don't have standing water. Next slide. Water, can be a reservoir for a lot of different things. I got this up here because at Hampton Beach last year in New Hampshire, where I live in southern New Hampshire. Not in Hampton Beach, unfortunately, but there was a Legionella outbreak at one of the resorts there from a hot tub, and up to 49 people, I think, was the final number infected, and we had a couple of fatalities from this Legionnaire's outbreak. Next slide. Vectors are living organisms that can transmit infectious pathogens between humans or from animal to animal. I just have one example up here as of a mosquito and the diseases that they caused and the type of pathogen that the mosquito is a vector for. My group actually, they were looking, I can't remember what it was, the purple tongue disease for deer or something. They were able to find out that it was transmitted from deer to deer through an insect, right? So that insect was a vector for transmitting that disease between the deer population. Black plague, right? What was the vector for Black plague? Does anybody know what that was?
Wasn't it the fleas off of rats?
Yes, fleas. Fleas. So fleas were feasting on rats that had the plague, and fleas jumped into, you know, the blanket or your clothes or the environment and bit the humans, and that's how it got transferred. Good, very good. All right, next slide. Zoonotic diseases are illnesses that can spread between animals and people. So, you know, our concern with infectious and new or emerging diseases are they come from an animal. You know, you probably remember back a few years, swine flu, right? There was a swine flu outbreak. You know, bird flu, that's on people's minds. So there's 8 zoonotic diseases that are of national concern in the US. Influenza, salmonellosis, West Nile virus, plague. Yes, the plague is still around. This tool is a really good document that the CDC partnered with the FDA and also the USDA. They have this very great document. I can post that on the instructor lounge. It's big, but it's got a lot of good information in it, and it might spark some ideas for doing activities for your classes around infectious diseases.
Hey, Bernie, I got a question for you. Can COVID be spread by mosquitoes?
We don't know. At this point, I don't think I recall seeing a study of that. That's a good question. Next slide. Portals of exit. So these are the routes by which the infectious agent's going to leave the host, whether the host is a human that was shedding, you know, the virus or the agent because it was propagating in you, or the exit portal is from a reservoir or an animal, something like that. Next slide.
Hey, Bernie,
Yeah.
are there any studies to show if any of this, you know, they were just showing the guy sneezing or whatever.
Yep.
How about those e-cigs? Is that an issue for any of this?
Yeah, so I haven't looked at e-cigarettes as far as a way that you might be able to transmit it, but if you are sick and you're blowing that out, then yes, anything that is getting air out of your body, laughing, talking, breathing, you know, blowing out smoke, sneezing, coughing, that's going to help distribute it.
Thank you.
Yeah, the study though, just to close my cycle of thought here, that I have looked at, is that people who do you know, use e-cigarettes, vaping, and smoking are at a significantly high risk to worse outcomes from catching COVID-19. Doesn't mean that you're necessarily going to get it any easier or less easier, but your outcomes, fatality is going to be higher. Your severity of symptoms is going to be higher. So that's important to know. Good question. How infectious agents are transmitted, very important for understanding how to break the chain of transmission. So direct contact is basically you have to touch something that's contaminated and then, you know, get that on your mucous membranes, your eyes, inside your nose, your mouth. Indirect contact then would be that something else like a tool or a guardrail or a hand railing is infected with some material, like somebody coughs on a handrail and then you touch that and touch your mucous membranes. Then there's droplet transmission, which is where this 6-foot rule is coming out, where the virus is only infective inside these larger droplets, which only will travel and stay in the air about 6 feet, which now actually we know is not true. We've got studies that show that large droplets from sneezing and coughing can travel up to 30 feet. And then the worst kind is airborne transmission, which means that the virus or the pathogen can stay in the smaller droplets of stuff that you expel, float around and stay in the air for hours and travel very far distances and basically expose everybody that may be in a room. Next slide. And vector-borne disease are human diseases caused by parasites, viruses, and bacteria that are transmitted by vectors. So I've got 2 common ones up here, ticks and mosquitoes. Next slide. And again, understanding this stuff is gonna, it's going to have a big impact on your members taking these classes because, you know, what's one way to prevent Lyme disease? You got to prevent the vector from attaching itself to you. So you wear long pants, long clothing. You might use something with DEET in it, right? You don't walk through tall grasses and things like that when the ticks are out in force. So understanding this is going to be a big benefit. A vehicle for infectious disease is an inanimate intermediate in the indirect transmission. So they were talking about indirect contact. So what kind of vehicles do I have up here? I've got public transportation systems, buffets, bye-bye buffet, and you know, bathrooms. So places where there's high contact issues can be vehicles. Next slide. Oh, that's right. I got to fix this slide. What happens at 2 meters when someone coughs? Oh, no, that's right. I have it right. Never mind. Sometimes I have slide titles where I get somebody to think about a question before I pop up a graphic and answer it. So we know when somebody coughs, you've got large droplets mixed with very tiny droplets that you're not going to be able to see. And those things are going to get projected. Droplet transmission is what we consider, as I said, to be in the large stuff that's going to settle out quick, less than 2 meters. Well, as the science is showing, it's going to be farther than 2 meters. But then we've got airborne transmission, which is the worst of it, because that means that this stuff is going to travel farther distances and be able to infect people easier. And
I think that's where a lot of confusion is today.
Yeah.
There's a misunderstanding about that.
Yeah, and I'm going to talk a lot about this when we cover COVID-19, because it's really important. Like I said, 95, 96, 97% of scientists, medical researchers, epidemiologists, infectious disease docs, they all agree that this is airborne transmissible. The only ones that aren't changing the tune to this yet is the CDC folks, which I believe are hamstrung by the federal government and not talking about what the actual issues are of COVID. But that's another class. Next slide. So this is a good example. I got to move around my little bar here. So aerosols that are less than 10 micrometers are basically things that we're concerned about. And we see that the larger things are going to, settle out around 1.5 meters to 2 meters. Coughs, we see that the V there stands for velocity. Note to self, I've got to make a key so that we don't have to know So V is velocity, and coughing is 10 meters per second. Sneezing is up to 50 meters per second. So we've done a lot of study over the last 5 to 10 years, a lot, especially over the last few months, about how far and how fast a cough or a sneeze might go. That's why it helps if you wear a face covering, even though it might not be preventing you, right, from filtering out the infectious particles around you. But it might prevent some of your cough and sneeze from getting way out there. We found that it doesn't completely stop it, but it reduces it, which is important. The more everybody can reduce something, whether it's coughing, sneezing, laughing, whatever, the more likely we're going to be able to flatten the curve of transmission. And then, of course, larger droplets are going to go farther. I'm sorry, not as far. Large spray droplets that might be smaller are going to be able to float around and stay on the air for longer periods of time. And with COVID-19, I don't want to take away from the next session, but we know that it can be infectious up to 12 to 16 hours in a room, floating around in the air. Next slide. Portals of entry are doorways for pathogens to get into a susceptible host. So mucous membranes of the respiratory tract or eyes or nose, GI tract, a urinary tract, breaks in the skin, sharps, right? So there's different portals of entry. Next slide. And again, some of those are going to be harder to control than others. The whole touching of the face, it's great to be mindful of it, but I've already done it a bunch of times since we've started, this session today. The final link is in the chain of infection is a susceptible host. So, different things might make you more susceptible to getting infected or having a severity of disease or the ability to fight a disease. This could be immunocompromised folks, folks with different diseases to begin with, elderly, folks that have asthma, or other respiratory ailments, folks who smoke or vape, That's going to reduce the ability to, fight infection from some of these things. Next slide. So this is kind of getting towards the end of the infectious disease transmission cycle and the slides here. So we've got 5 periods of infection. The incubation period, the primordial period, which is basically when you're starting to shed the disease and you're starting to get symptomology. You got period of illness, so this is when you're getting sick. You've got period of decline, you're starting to get better, and then convalescence or the recovery phase. So if you click again, we've got some more generalized terms. So I'm infected, starting to feel sick. Okay, I'm really sick now. Don't bother me. I'm not getting out of bed. You start to feel better. I'm starting to get back to normal activity, and then you're completely back to normal. And these periods are going to overlap, right? It's not like you've got strict cutoffs for these, and they're going to be different for everybody, right? Next slide. There's some barriers to help invading pathogens. So we've got non-specific physical and chemical defenses like barriers of your skin, mucous membranes, innate immunity, so macrophages, so those white blood cells that are in your body can help deal with some stuff that invade. And then you've got adopted immunity. So maybe you've gotten a disease already and you build up some antibodies. It doesn't mean you're good and you're completely at risk, at no risk. You still have some risk, but you're more likely to not get infected again or to be able to repair and build up back from being infected. For instance, the flu vaccine. We get injected, every year if you get a vaccine with some viral flu that they decide to choose different strains that they're likely to see in the population at high levels. You develop antibodies to try to fight that. It's not actually live virus. So you develop some antibodies. You still may get the flu. But if you do, you might not get it as long. Your symptoms might, instead of 10 days, only last 5 to 7 days. You might not have as severe symptoms. Or maybe you get protected and you don't get that strain of flu at all. So there's some good reasoning behind getting vaccines. Next slide. Again, understanding the different parts of the chain can help implement controls to break that chain of infection. Next slide. These are some infectious disease. These infectious disease agencies are within our federal government. So we got the Department of Health and Human Services, the CDC, National Institute of Health, and then the National Institute of Allergy and Infectious Disease, which I think is actually where Dr. Fauci works out of. Next slide. They covered infectious diseases in different categories. So category A, priority pathogens, B, C, and then emergent infectious diseases. So they're going to try to, distribute their funds and the resources to try to look at what's most likely to harm the public health at any given year. Next slide. These are components of infectious disease occurrences. So you've got an outbreak where you've got an illness, maybe a few people might get it, maybe you've got clusters in certain areas. Then you get to an epidemic where that infectious disease starts to spread to more and more people. You've got a wider cluster. So an epidemic might be, say, an outbreak of a state, or maybe a whole large, city or something like that. But it hasn't gotten outside state borders yet. Maybe it's still contained in a county, something like that. Then you've got the widespread pandemic, which multiple countries across the globe are affected. It transmits very, very quickly, very easily, and it affects more lives, obviously, than a pandemic would, than an epidemic would. Next slide. The World Health Organization has an alerting system on 6 phases for pandemics, phase 1 through 6. Phase 1, a virus in animals has caused no known infections in humans. Then we see phase 2, where an animal virus transfers to a human. Then we get all the way up to phase 6. At least one or more country in a different region from phase 5 has community level outbreaks. Next, please. Epidemiology, very important. When I've got a problem with my car, I'm going to go to my mechanic, right? I should be going to a professional taper to finish off my walls, much to my wife's detriment, because my taping job sucks. I grew up helping my brother hang drywall and tape. I never learned the taping part too good. So it looks more like a bad experiment in an art project than it does a professional taping job. But the point of my story here, with infectious diseases, with outbreaks, with pandemics, we need to listen to our experts. They're the ones who are going to help get us through this and give us the right science to get us through this. So it's important that we listen to epidemiologists and infectious disease experts to help quell this pandemic, not folks who don't know what these things are.
Hey,
yeah.
If you don't mind, we've been going for a bit here, and I know I just want to make sure nobody's chomping at the bit and wants to ask a question. I didn't. If you took me wrong at the beginning that we have 30-something people on and we want to make sure we get to the material, and that's the reason we're not asking any questions, please ask the questions. We'll get through the material. So does anybody out there have any questions at this point in time? Because you're more than free to ask questions. We'll answer any questions that you have or possibly can have. As we're going through, maybe it might be something that you need a little bit more information on so you can portray it to your members a little bit more correctly. But yeah, please ask the questions if you got them. Don't be afraid to ask.
Yep.
I'm kind of saving mine for the COVID section. I think a lot of us will probably have more questions in the COVID section as far as the way some things work and why things are the way they are. So I'm just trying to put it in the appropriate spot.
No, you're absolutely good. Like I said earlier, we're all instructors here. We know how we can get as instructors. Sometimes we just keep on rolling and we don't get that opportunity for our students or participants to ask questions. So I just wanted to make sure we took that little bit of a pause here and made sure that nobody was jumping at the bit to ask the questions. So fantastic. Thank you.
Yeah, thanks, Ken. Well, seeing as none, we'll keep going. So epidemiology, it's the study of disease within a population. You know, it helps us prevent and control infectious disease outbreaks. They're basically like detectives, right? So here I got Dr. Fauci and Dr. Birx up there. You might have seen them a lot in the very beginning of this. Unfortunately, right now, you don't see them at all. That might be better because we might be actually getting better information from them if they're not at a White House press briefing. And they're important to listen to. Look, I had to take epidemiology and biostatistics as a graduate student. I understand it, I use it, I depend on it, but I'm not an epidemiologist. I don't intend to be one, and I would not want to actually do that work because it is very tedious, difficult work to do, but I thank God for them. So epidemiology is very important. Next slide. How can we prevent infectious diseases? Right, we've all are very familiar with this hierarchy of controls. You know, elimination, so you got things like vaccine, social isolation, quarantining. There's not really a way to substitute on the hierarchy of controls. Engineering, ventilation, UV light, things like that, containment, and we're going to get into this, you know, during the COVID portion, and we've been talking about this with our directors of training, like seminars and meetings and stuff like that, because engineering controls are going to be very important for opening up training centers and also keeping us at a reduced risk anytime we're indoors. One of my favorite activities are going to the movies. And unfortunately, I will not be going to a movie theater in the near future, knowing how the ventilation systems typically work in places. Administrative controls, so infectious disease plan, very important. Social distancing, you know, hand hygiene, and then of course PPE. Next slide. There's a difference between quarantine and isolation. I think it's important for members to know that because these things have been intertwined during the COVID-19 pandemic beginning here. So quarantine, these are restrictions on the movements of an otherwise healthy person. So the intent here is to make sure that, you know, somebody might have been exposed and you want to make sure that if they are sick and they do have it, that you're not going to send them out into the environment, into public. So you're quarantining somebody who's healthy, as opposed to isolation. So we know somebody is infected and we don't want to get them intermingled with a healthy population because they're going to transmit the disease. So there's a difference between quarantine and isolation. So you might hear like, okay, I was around somebody that I know is COVID-19 positive, so I was asked to do a 14-day quarantine. Doesn't mean you're sick. It means this, in case you are, you're staying away from other people. Next slide. And, you know, the isolation thing, the quarantining, the social distancing is really important because this is an example of a graphic from the New York Times. Breaking the chain can really impact, you know, a community. So up here, if I took an RO, infection rate of 2, we see that one person is going to infect 2 people, and then those people infect 2 people, and so forth. We see the number of dots there at the bottom. Those are all infected people after 1, 2, 3, 4, 5, 6 generations, right? So if we look at the bottom, so one person was not going to contract the disease. So now we're just left with the person on the left that did, and then they go through there infecting 2 people and so forth. So we see what a big difference, you know, cutting off that chain of transmission does. So if you cut the chain of both people off, nobody gets infected. You're left with the one sick person who has to isolate, and we've just potentially saved a lot of people's lives, their well-being, their finances, etc. Next slide. And it's important to talk to members about that because, again, it's not just, you know, oh, I'm a tough guy, you know, I'm gonna get this, I'm gonna be just fine. Well, that all well might be and good, but you can't be tougher than a virus, first off. And second off, you're not just in this alone. If you are preventing a transmission of an infectious disease, let's take COVID-19, you're helping out your neighbors, your family members, you know, your parents, your kids, your wife, your work, you know, your workmates, etc. This is something that we truly are all in together. Infectious disease resources. Here's some things that you can direct members to or that you can use, you know, for preparing for class. Next slide. This is a great one out of Canada. So I have not used this yet in app on my cell phone, but I went to the website to use it. And this is a great little tool where you can actually search up a pathogen by name. You can get information on it, and it comes in these really nice drop-down menus. I recommend everybody try this out. It's great. And again, the more information as a trainer that you can gather and prepare yourself, the better. One of the certifications I have, I'm a certified environmental trainer under the American Board of Safety Professionals. That used to be under the National Safety and Health Trainers Association. Now it's called a Certified Instructional Technologist. We've changed it for some reason. But what that organization recommends is if you know the material well, that you should at least spend 4 hours for every 1 hour you're going to present to prepare. Now, I know that sounds like a lot, but if you really want to be up there and be on point and just be able to interact organically and comfortably with the class, you got to put the time in. So make sure that you're getting access to that time. You know, if you have a manager of training or something like that, I don't know how the IUPAT works, but you really want to try to promote as much prep time as you can to deliver material, especially if you don't know it. I prepared for delivering this class this morning and yesterday. Last week's class, I prepped more because I didn't deliver it yet. So with each time, it gets better. But still, I'm going to want to make sure I'm going over, even if it's a HASCOM class, which I've delivered, I don't know, probably close to 1,000 times. Regardless, I would want to still do a search on HASCOM, see if there's any pertinent news stories about it. You know, for instance, I did a HASCOM class for a small science group that I know very well. And what I did is I looked at some recent issues in the news about HASCOM where there were some experiments that went awry and blew up. And some of the underlying reasoning for that was due to HASCOM issue, communicating the hazards of chemicals. So I want to make sure that I'm getting, you know, some pertinent up-to-date stuff. Next slide. And if anybody's interested in becoming a certified instructional technologist, let me know, and I will be happy to send off the information for that organization to you. With that said, this is our closing activity for infectious disease. What it is it is activity 4, and this is an activity right out of the Center for Disease Control's self-paced epidemiology course, which you can take. It's going to ask you to review some information on dengue fever, and then you're going to answer 5 questions on the cycle of transmission. And again, if you are comfortable that your students are comfortable with the cycle of transmission, you did your job for talking about infectious disease. The goal isn't to get people to remember or memorize a bunch of infectious diseases and what those outcomes are. The goal is to get people comfortable with the infectious disease transmission cycle, some of the basic definitions, and then how to look information up on them. Just like my group was able to talk about infectious diseases which are pertinent to their area. That's awesome. With that said, Ken, how do you want to handle this one? Because we are at 2:18. You want to do this one as a large group again?
It's, yeah, Bernie, if you don't mind, I think we had some really good conversation last time. I think a larger group would be good on this one, and then we'll do some breakouts on the others. It sounded like people really wanted to get to the COVID. It'll give us a little bit more time there.
Sounds good. So Ken, do you want to facilitate this activity, and your co-instructor is going to make a restroom run?
I can actually, we can actually do that if you don't mind. I have to.
Thank you.
I have to get the material up here. So understanding infectious disease and chain of infections. So that's kind of the activity that we're going to work on. And it's information about dengue fever is provided below. After reviewing this information, outline the chain of infections by identifying their reservoir, portal of exit, mode of transmission, portal of entry, and factors in host susceptibility. Does anybody want to read dengue fact sheet? What is dengue fever, or would you like me to continue, or do I have a volunteer? No volunteers. I will go. What is dengue? Dengue is an acute infectious disease that comes in 2 forms: dengue and dengue hemophobic fever. The principal symptoms of dengue are higher fever, severe headaches, backache, joint pains, nausea and vomiting, eye pain and rash. Generally, younger children have a milder illness than older children and adults. Dengue fever is more severe form of dengue. It is characterized by a fever that lasts from 2 to 7 days. That's a long time, with general signs and symptoms that could occur with many other illnesses: nausea, vomiting, abdominal pain, and headaches. This stage is followed by hemorrhages, manifestation, tendencies to bruise easily, or other types of skin hemorrhages, bleeding nose or gums, possible internal bleeding. The smallest blood vessels, capillaries, become excessively permeable, leaky, allowing the fluid components to escape from the blood vessels. This may lead to failure of a circulatory system and shock, followed by death. If circulatory failure is not corrected, although the average case fatality rate is about 5%, with a good medical management, maturity can be less than 1%. What causes dengue? Dengue and dengue hemorrhages fever are caused by any one of the 4 closely related design, DEN 1, DEN 2, and DEN 3, or DEN 4. How is dengue diagnosed? Diagnosis of a dengue infection requires laboratory confirmation, either by isolating the virus from serum within 5 days after onset of symptoms, or by detecting convalescent phase specific antibodies obtained at least 6 days after onset of symptoms. What is a treatment for dengue? There is no specific medication for treatment of dengue infections. persons who think they have dengue should use analogistics, pain relievers with sorry about that, can't pronounce that word.
Acetaminophen.
Thank you,
Acetaminophen.
appreciate that. And avoid those continuing aspirins. They should also rest, drink plenty of fluids, and consult a physician. Person with dengue, hemorrhages, fevers can be effectively treated by fluids replacement. Therapy and an early clinical diagnosis is made. By hospitalization is often required. How common is dengue and where is it found? Dengue is endemic in many tropical countries in Asia and Latin America. Most countries in Africa and much of the Caribbean include Puerto Rico. Cases have occurred sporadically in Texas, occurred periodically globally on an estimated 50 to 100 million cases of dengue and several 100,000 cases of dengue hemorrhages, fevers occur each year. Depending on the epidemic activity, between 100 and 200 suspected cases are introduced into the United States each year by travelers. How is it transmitted? It is transmitted to people by bite of mosquitoes that is infected with a dengue virus. The mosquito becomes infected with dengue virus when it bites a person who has dengue or DHF, and after about a week can transmit the virus while biting a healthy person. Monkeys may serve as a reservoir in some parts of Asia and Africa. Dengue cannot be spread directly from person to person. Who has increased risk of being exposed to dengue? Susceptibility to dengue is universal. Residents of our visitors to tropical urban areas and other areas where dengue is endemic are at higher risk of becoming affected, while a person who serves a bout of dengue caused by one stereotype develops lifelong immunity. With a stereotype, there is no cross protection against the 3 other stereotypes. What can be done to reduce the risk of occurring dengue? There is no vaccine for preventing dengue. The best preventative measures for residents living in areas infested with the Aedes, I can't pronounce that other word, sorry about that, is to eliminate the places where the mosquito lays her eggs, primarily artificial containers that hold water. Items that collect rainwater are used to store water. For example, plastic containers, 55-gallon drums, buckets are used. Automobile tires to be covered or properly discarded. Pet and animal watering containers. Vases, fresh flowers should be emptied and secured at least once a week, scored at least once a week. This eliminates the mosquito eggs and larvae and reduces the number of mosquitoes present in these areas. For travelers to areas with dengue, as well as people living in areas with dengue, the risk of being bitten by mosquitoes indoors is reduced by utilization of air conditioning or windows and doors that are screened. Proper application of mosquito repellent containing 20% to 30% DEET as the active ingredient, and exposed skin and clothing decreases the risk of being bitten by mosquitoes. The risk of dengue infection for international travelers appeared to be small unless an epidemic is in progress. And epidemic be dengue, hemorrhages, fever be prevented. The emphasis for dengue prevention is on susceptibility, community-based integrated mosquito control with limited reliance on insecticides, chemical preventing. Epidemic disease requires coordinated community efforts to increase awareness about dengue DHF, how to recognize it, and how to control the mosquito that transmit it. Residents are responsible for keeping their yards, patios free of sites where mosquitoes can be produced. Sources, that's the sources that the article came out of. And then we're going to go into answering the questions. But for an example of mosquitoes and how they, so when we were going through the foreclosure phases in Las Vegas, that's where I live, there was a lot of pools that went green, and the pools really got really dirty, and we had a big population of mosquitoes. So there was actually people going around to these vacant properties that were in foreclosures and either emptying their pools out or cleaning the water so we could reduce the infection rate of the mosquitoes that we had in Las Vegas. So that's just one route. Now that you have read about dengue fever, outline the 5 aspects of its chain of infections below. So if I can get you guys just to take a few minutes and answer these questions, and then we'll get you to answer them online here.
Thanks, Ken.
It's a long read, but it's a good read.
It is, and you know, if it's useful, I actually have the module in a PDF from the CDC that I could post in the instructor lounge.
I would post that in the instructor lounge. So while you guys are doing your questions there, 1 through 5, if you get onto the LMS system, you can get to what we're calling the instructor lounge. We've tried this in the past, but there's always been questions is how do we communicate with other instructors or other regions or district councils? And we've tried this before. It's up there, it's active. Please sign on to the instructor portal. And we'll get that running. But if you have questions, you can put it in there. If you want to find information, you can find it in there. It's a great resource. So LMS, find the area it says instructor portal, sign on, your account will be activated, and you can actually start using that particular area. Oh, and if you look underneath the chat, it is there for you, the access to that, where to find it. Bernie, we'll give it a couple minutes and then we can ask the questions on 1 through 5. And Bernie, I'm glad Dr. Fauci is kind of stepping back and using his own words at this point.
I'm surprised that he didn't get fired yet.
No, but I'm glad he's using his own words.
Yeah, I was actually able to successfully post a few things myself this morning in the instructor lounge, so.
Nice. It's a good tool, only if we use it. So let's use the tool so we can keep it up there and share some great information. Bernie, let's go ahead and we'll ask these questions here. We'll get some answers to it, then we can move on to the next section.
Sure. So what did folks come up for reservoirs?
Monkey.
Yep.
Humans.
Yep, monkeys and humans. How about a portal of exit?
Skin.
Yeah. Yep, good. Skin because of those damn mosquitoes. You know, the only good thing about mosquitoes is they got us a Jurassic Park movie, because without mosquitoes, we'd have no Jurassic Park. Otherwise, what the hell? How about a mode of transmission?
Bites.
It also looks like it could be passed from a pregnant mother to her baby.
Okay. Good catch. Good catch.
That's a good catch. Yeah, good catch.
The main would be mosquito vector. Very good. How about portal of entry?
Skin.
Yeah, skin through the damn mosquitoes. Factor in host susceptibility.
It can't go from human to human is one factor. Is that right?
So that's a factor in mode of transmission, but they were looking at is there any certain population that might be more susceptible to get sick? And the answer to this one was no. They consider it universally susceptibility. So it doesn't matter where you are, who you are, everybody's susceptible for getting dengue fever. Good. So, I thought about putting a COVID-19 fact sheet activity in here, but we don't know enough about it to have like a fact sheet like this where folks can read it. You can do the same thing with any pertinent infectious disease as long as you've got access to a fairly short activity. And the CDC wrote this dengue fever fact sheet for the activity. But let's say if you're doing this class, in the fall, I would throw seasonal flu in there maybe, So, as long as you can find something that might match a little bit nicer with the population you're teaching, go for it.
Hey, Bernie, and just so everybody knows, the infectious disease part that we just did is very, very important, and we can't overlook it. I know the word of the day is COVID-19. It's a very serious virus and pandemic that's out there. I get that. But that's what everybody's talking about. That's what is on everybody's mind. And we all know as instructors, and that we've been in the trade so long, is if we're concentrating on one thing, we're forgetting about all the other safety issues. We still got, the factor 4s out there that are killing people, and we still got other diseases out there and viruses that are killing people. So we just want to make sure that, when you're talking to your members, you're just not stuck on COVID-19, even though it's important for them to know how to protect themselves. But they also have to know they also have to protect themselves from other things. So that's the importance behind that particular module that we just went through.
Yep. Thank you, Ken. And you'll see when we get into, can you back up just one slide, please? While I remember, I always like to put in, photos of members and stuff like that to be pertinent to the class I'm trying to develop. This here is a group of operating engineers that I did a radiological safety class for. I don't have any good classroom pics of IUPAT members. So if anybody's got some, if you wanted to throw those up in the instructor lounge, I would love to change this picture out. Because as much as I like the operating engineers, I'd like to have an IUPAT classroom pickup here. So if anybody can help us out with that, that would be awesome. You're going to see in the ICRA course tomorrow, the ICRA module, why it's important, what Ken just said, because there's a lot of stuff that you have to, cover for, not just COVID-19, but, we're going to look at bacteria issues at hospitals, viruses, obviously, and mold. Mold's an issue with protecting at-risk populations in healthcare settings and other settings. All right, let's get into our next slideshow. So we're going to get into COVID-19. We're going to end probably within 5 minutes of 4. Wait, what am I doing? 3. 5 minutes of 3. If there's any questions or so, and I'll let Ken manage that part because you did a great job with that last time. And then we're going to pick up tomorrow and we'll be able to get through everything. I think we did pretty good today. So now we're going to get into COVID-19. And this does need to be reworked quite a bit because even since last Friday, so much information came out last week about COVID-19, new information. And I want to start off this, since you're all instructors and can get the word out, that there was a lot of misinformation that came out in the beginning. And Ken and Alice and Donna and Nicole, if you're on, I apologize for sounding like a broken record because you keep hearing me say this, but it's important to make sure everybody knows. There's some misinformation that was put out that made it harder for us as a country to respond because we didn't have good, solid federal leadership. One of them was they told the general public that N95s, masks aren't going to protect you from COVID-19. And by the way, please don't use them because we need to save them all for our healthcare workers. And you're like, wait a minute, you're telling me that a mask isn't going to protect Bernie Missoula out on the street, but it's going to protect, somebody working in a hospital. Well, that doesn't make any sense, especially since the folks in the hospital probably have a higher risk than I do. So what we found out was that there was not enough N95 respirators. There was not a sufficient national stockpile. So the CDC actually changed the message about the transmission and about the PPE that could protect us against this. That wasn't good. The other issue is we heard about the social distancing. It started off with 3 feet. It started off by saying stay at least 3 feet away from everybody when you go out in public. And then they even started to add in different distances for different populations. Like they said, the general public can be there 3 feet, but if you're a cop, you got to be 6 feet away. Well, wait a minute. Why does a cop get to be 6 feet away and I have to, get stuck with 3 feet? So we found out that, again, a lot of this stuff was used from very old studies, back from 1918, studies from 50 years ago about transmissible respiratory diseases. And we've got so much information out there right now that definitively points that the COVID-19 is an airborne transmissible disease. You can get it from inhaling or having contact with the aerosols that are floating around on the air, and that can travel great distances. With that said, the other thing to know as trainers is that we've got a decent equation now for risk when it concerns indoors. So basically it goes like this. If you're indoors, your risk is going to go up. If you're indoors around more and more people, your risk is going to go up. If you're indoors and you're around more and more people for a longer period of time, your risk is going to go up. And then the last thing is, if you've got bad ventilation indoors, your risk is going to go up. So we've got 4 kinds of factors here that are going to either decrease or increase our risk. If you're indoors to begin with, if you're around people, the more and more people goes up. If you're in there for long periods of time, your risk is going up. And if you've got poor ventilation, your risk is going to go up. And I can tell you from doing dozens and dozens of indoor air quality assessments that I typically find that the HVAC system, the ventilation system of buildings, and I've done IAQ assessments from hospitals to schools to community housing environments for the elderly. What I've seen was terrible. I usually, the first thing I'll say is, hey, can I get your maintenance records for HVAC systems? And they say, what do you mean? What do you mean? You mean when they installed the system 50 years ago? No, I mean, like, when's the last time you cleaned this thing? When's the last time you checked the drip pans, changed the filters? So that equation is going to be very important. Are you working indoors, around people for long periods of time? And how is the ventilation system? So keep that in the back of your head as we're going through this.
Especially the reopening up of training centers after being dormant for as long as they have been.
Yep. And I did post the AIHA guidance on getting your buildings ready for reopening. What Ken was speaking to specifically on that instructor lounge this morning. Now, keep in mind too, this is you've got 2 kind of risk categories for your members, right? You've got members who are going to be working on largely outdoor environments. So maybe you're doing some coding on a bridge or, a large tank or something like that outdoors. Or are you going to be going and doing work, hanging wallboard, taping, painting on the indoor environment when you've already got the outside building envelope starting to be sealed off? Your risk is going to go up. But if you're outside painting, your risk is going to go down. So keep that in mind, whether it's a construction site or you're going indoors to do something for your training center. All right, so let's get into this module. So we're going to look at the basic facts of COVID. We can go ahead, Alice, or whoever's doing the slides. I'm sure everybody read that already. So what is COVID-19? There's many types of coronaviruses, common cold, SARS, and MERS. We gave some examples of that. This slide here wasn't really, updated that much.
Next question.
Slide. Yeah.
What is the survival rate of COVID-19?
Good question. So we have a slide that will speak specifically to that. So I'll wait till we get there and we'll look at it. And I updated that one. So I see we got about 5 minutes. I'm going to go through this and I'm going to stop at the slides that were updated or where there's pertinent info. And then we're going to close down and continue tomorrow.
We got about 15 minutes left for
15.
today, Bernie.
Okay,
Yep.
Perfect. Next slide. Coronavirus disease that arose in 2019, they believe in December in Wuhan, China, but it actually might have been originated even earlier than that, and it might have hit our soil earlier than January. Again, we're not going to know till this is the research on this is over. It can have, no symptoms. We know that people can be asymptomatic. You can have mild-like symptoms, but it can go all the way up to death. Next slide. So I guess I should update this map, unfortunately, and I'm going to guess, in fact, I'll look, that we might have hit 110,000 fatalities right now.
I think we're pretty close to that, yes.
According to the World Health Meter, which is usually a little bit updated than our CDC. So at 109,650 deaths so far. This map needs to get updated. Unfortunately, we've got about 20 states that are seeing increases, including some states, I think it's around 3 to 5, that have seen a 50% or more increase in cases. Now, some of that was due to the way that those states decided to open up their states and go back to some type of normalcy. And some of them have been due to the open up protests that happened, obviously. And then some we're going to probably see, a few weeks coming up about the current, Black Lives Matter inequality protests, obviously. Congregating in huge groups like that, it's going to increase the risk. Next slide. Testing limitations. So this was another issue. We didn't have, the federal government did not have their act together for testing to begin with. I know that you might have seen some news conferences by the White House that said nobody's tested more people than us. Well, yeah, after 3 months, okay. But if you look back when this first started, when we knew that we needed testing, we were very, 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 very far behind other developed countries in testing. If you look at places like Australia, New Zealand, Canada, South Korea, Germany, Norway, Iceland, they tested far more people than we did much more quickly. Now we've surpassed them because we've got much larger populations and we've also had 3 months to catch up. But what we need is a lot of testing very quickly. The most recent thing I've seen from Harvard was Harvard Medical School said that we need to test about 5 million people a day to be able to go back to work with some confidence of safety. The other issue is there's been some conflagrating of tests. What that means is if you're a trainer or if you're an IUPAT member, depending upon what state you live in, you should see how your state has counted numbers. Because unfortunately, some states, Georgia, Florida, they have taken antibody tests and they've combined that with positive tests, which are 2 different tests, to make it look like they've tested a lot more people. That also makes it look like, your testing, your values are different. That's
Bernie?
not okay. Yeah?
We got a great suggestion, and it's from our Canadian brothers and sisters. Can we have Canadian numbers added here for our classes?
I would absolutely do that. Yep, that's a great suggestion.
I have a 2-part question. As far as testing goes, I've just heard so many different things on the antibody tests. Do they have antibody tests that are accurate now? And what does it mean if you show antibodies in your system to the virus? And part 2, I guess, or part 3, however you want to look at it, is if this can be spread from 6 feet away, and this kind of started as a Facebook meme that people just keep asking about, but it's turned into a pretty good question. If this can be spread from 6 feet away, why is the test, do they stick a Q-tip, whatever, to the base of your brain instead of just wipe the edge of your nose if you can get it from 6 feet away?
Very good question. So the first question is on antibody testing. The most recent, and again, when I go to look for information, I'm going either to Harvard Medical School, sites. I'm going to peer-reviewed published journals in like the New England College of Medicine. I might look at a peer-reviewed paper for the WHO, things like that. So I want to make sure that I'm getting very good, as much unbiased information as I can. And right now, it seems like the antibody tests are, they need some work. You know, there's a lot of issues with false positives, potentially false negatives. So we need some more work on those. And what it means is if you get antibodies, you probably were infected with COVID-19. And according to the WHO most recent statement on this, there's no evidence that you cannot be reinfected right now, just because you were infected once. That's their most current statement on that. And you can, you know, there are instances where you can be reinfected by the same virus. So it's, you know, it's there, it's possible, but not always. So we need to have more understanding on that. Now, why they put that swab way up there is they want to make sure that they're getting as good a representation as they can of your mucous membrane. So they're not looking for virus that might have landed on the inside of your nose. They want to see if you've got virus in your body that is shedding, that is using the energy system of your cell, degrading it and moving on, doing its business. So that's why they're actually looking for your mucous membrane activity compared to, you know, what might have landed on the inside of your nose. So they stick that thing way up there to make sure that they get a good sample. Good question. It's not comfortable. I've had it done, not for COVID-19, but I've had it done for flu. Good question. Moving on. Yes.
I just had a quick comment about the testing. Here in Canada, they've actually switched from going back into the back of your nasal passage, and they're doing cheek swabs now.
Okay. Okay. Okay, yeah, so there's a lot of limitations on testing right now, but right now what we know we need is we need a lot more testing, okay? And we need it to be able to open up safely. If you look at countries that had little cases, and I guess I could say little economic impact compared to, say, us or some other countries. So I'm talking about Germany, you know, South Korea, New Zealand, Norway. It wasn't just because, it's funny, all those places have women leaders. Interesting note. Anyway, we'll talk about that later.
Hey, Bernie,
leaders in general.
Okay, touche. Leaders in general.
Bernie, just we had a quick comment here, and it just says that they heard that immunity is just a fallacy in this case.
Yeah, so we don't know yet. I've heard conflicting reports in the literature that say, well, no, you know, you just had still active virus there, even though your symptoms went away and you were in the convalescent stage, you can go back to normal work in life. Or there was, you know, pieces of the virus left. So that's what the test is picking up. I don't think we know yet. I don't think we know yet. So that's a good point. But yeah, so leaders in general. But what they did is they tested like crazy right off the bat. A lot of them were very strong at their stay-at-home orders immediately and requirements of masks immediately. So they did all those good things right. And then after a couple weeks, they could start reintroducing people back out. You can see what we did wasn't that. And you can see what some places did, like Italy, you know, wasn't that, unfortunately. And the reason why, am I critical? Absolutely I am. Or as my grandmother would say, you bet your dupa I am. She was Polish, as am I. Why am I critical? Because we're going to have this again. We're going to have, potentially a second spike in this first wave. We're going to have another wave. We're going to have another infectious disease epidemic or pandemic in our lifetimes. So we got to make sure we erase these things that we did incorrectly and we do it right next time. All right. So that's why I'm critical, if it sounds like it. Next slide. Transmission. So, you know, these are the potential ways that we had up there, but we know that this is airborne transmissible. It is infective on the air for up to 12 to 16 hours. If you're in a room, okay, let's say you're in a cafeteria or something like that, or you're in one of your training rooms. If somebody's sick and they're breathing and laughing and they don't know it, everybody in the room within some time period, and it's not long, it's certainly within an hour, is going to be exposed to that person's vapor from them laughing, talking, breathing. It does not take long for aerosols that you generate from your nose and your mouth to get around a room and expose everybody in the room. So that's unfortunate because airborne transmission is harder to control. Next slide.
We have a question. It says, why is the military going to administer vacant vaccines when available? Adam, did I get that correct?
That was a mistype on the bacons. I meant vaccines. The president said that the military was going to administer vaccines as soon as the 100 millions or whatever was going to be available. Why would the military do that?
That's a damn good question. I don't know, because he's the president of Law and Order. So, God, this isn't funny, but it's funny. So, look, the Surgeon General, right, the nation, quote unquote, top doc, they're housed really under the Department of Navy. So the Navy historically was the division that gave us, you know, I guess medicine, so to speak. So my mentor, Dr. Rob Palermo, he was a Navy captain, retired, really good guy. You know, they're there to support only. I mean, I could see National Guard and things like that, maybe the Department of the Navy helping to administer stuff. But I gotta tell you, man, after what I just saw on the television, you're going to have more than half the population get nowhere near somebody with a vaccine if they've got military fatigues on and an M16. Good question. I don't know. That's just insane. But they shouldn't be administering it. It should be done through your local health communities, through your local departments of health and human services, coordinated, right? Good question. Boy, the IUPAT asked some good questions. This is really important to understand, broaching the subject. So COVID-19, it's airborne transmissible. It's a key factor in risk. We see this graphic here on the left. The smaller particles are going to stay suspended in air for much longer. So if you cough or sneeze, the big stuff that you can see in one of those like frozen photos, that's around 10 microns or so. So those are going to be able to hang around in the air, though, still for almost up to 10 minutes. The smaller things, though, 3 and less, you know, we're talking hours now. And the particle size that can get deep in our lung, you know, are between 0.5 and 1 micron. So these things can be suspended in air for very long. And we know that the virus can be infective in them or active for up to 16 hours. So putting that stuff together is an issue, because that means that, you know, if somebody was sick in a room, unless you've got a good ventilation system, you know, your risk of getting infected or exposed to that person's infective aerosols is up there. Transmission modeling for how this stuff works has been telling. So there's some really good 3D models of people, say, going into a grocery store and what happens if they cough or sneeze. So the modeling shows the vapor cloud from someone's, you know, cough or sneeze up in the air. It travels over your grocery aisle shelving, and it goes into the other aisle. So airborne patterns are really tricky indoors when you've got things like a ventilation system, lots of human beings that have heat, which move air. You know, different obstacles in your way, like desks, shelving, you know, etc. So it's tricky. And then there's the other issue that we've found RNA, so parts of the virus, on particulate matter, particulate size 10 matter, which is air pollution. And we found that places communities like, you know, LA and stuff that have higher air pollution, folks there have been having more severe symptoms, and they've been finding, you know, the virus RNA on the particulate matter pollution. So what we need now is to find out if that virus is live on air pollution. So that's not good news, but we have to see what the study is going to flesh out there. So take home from this slide, it's airborne transmissible. If you cough or sneeze or even talk, it's going to stay floating around indoors for a while, up to 16 hours, maybe more, maybe less. But it's something that you have to deal with, and you have to deal with it through, you know, certainly a good ventilation system. Next slide.
Hey, Bernie, we got about 3 minutes here. I kind of like to leave it open for a few minutes if you don't mind, and we can continue off tomorrow on COVID, the COVID-19, if you don't mind. But I want to give the group here some final thoughts if they have some of what we talked about today, or maybe a question they might have.
Sounds good.
Anybody got anything a question or comments or anything right at the moment? Everything's on the table. There's nothing off the table. You can ask whatever you need to ask.
Well, as they're thinking about a question, Ken, I just want to say thank you to everybody for joining us today and tomorrow. And I know I just went through a lot of bad news, but I do have good news for everybody. I found out that Jimmy Buffett finally released a brand new album. So after I get off with you guys, I'm going to get a margarita and we're going to listen to it.
Awesome.
I might even put on a hula skirt and a Hawaiian shirt. We'll see.
Yeah, parrot head, man.
Well, I think it's very important when we're, this is important stuff that we really need to make sure that our members are aware of. It's our responsibility as instructors to make sure that our members and even staff are safe. And I don't think people understand how important knowing the fact that this is airborne transmittable and that the 6 feet is a joke. I think Bernie would stick up with me on that. It's a joke. You should throw that 6 foot out the window. And then you got the cloth mask. I call them face coverings because they're not a respirator. Face coverings, that'll keep it, somewhat from going out to 27 feet, but we don't know. There's no research or data or scientific data that shows me how much that blocks. It probably blocks some, but I don't know what the distance it will block it is, right? So there is some protection there, but it floats in the air. It's airborne transmissible. So our key is what do we do to lower the risk for our members and staff? And I think one of the ways that we can do that is training, understanding, and getting the right data, the right information out to them so they have the proper opportunity to protect themselves. So this is a serious thing. Like Bernie says, it's not going to go away. It's some other pandemic or this will come back. It's going to be a second wave, and we just need to make sure our members are prepared for that. Comments? So tomorrow we're going to go, so real quick, tomorrow we're going to go over the rest of the COVID-19. Then we're going to get into ICRA. I've got a feeling there's going to be a lot of questions on COVID-19. Please ask the questions. COVID-19 is important right now. It's not the only thing, but it is important. There's some areas in the ICRA that we could skip through if we're running out of time. So please ask your questions so that way we can get proper information to the members. That's what I got. Anything else, Bernie?
No, I mean, I've worked with most major international unions, off and on over the last 25 years. I got to say that, the IUPAT is very uniquely positioned with the number of instructors you have, the number of training sites you have to really make a big impact. And, I've worked pretty closely with you folks the last, 5 months to be sure. But I mean, all of your members, I see you folks taking stuff really seriously and you really try to do a good job of this stuff. So I don't have many good shining lights practicing industrial hygiene because it's usually, a lot of bad news and not exactly the most, noteworthy profession out there. Usually people say, what the hell is industrial hygiene, Bernie? Then I have to take, 30 minutes to explain it to them, which they run away. But I got to say, I'm really uplifted, being able to work with you folks because I'm really excited about, the change that you can make, in doing the training that you do. So thank you. This is a thank you from me to you all.
I think a lot of the stuff you're teaching us is in our wheelhouse. We deal with lead, silica, asbestos, and all that stuff. So it's so similar.
Yeah. And I was, told by Ken, a lot of you folks might have better respirators, the elastomeric, at least half face respirators, because you do paint and the IUPAT works with a lot of chemicals. I
Oh, yeah.
mean, you know, you're well positioned to do this stuff.
Excellent. Well, again, I appreciate everybody's participation. Great course today, I think. I appreciate the administrators helping us out on the back end here. I truly cannot do it without their assistance. I can't do my job without their assistance, to tell you the truth. So the administrative staff is always appreciated. Just want to make sure that I put that in there. And Bernie, thank you for your time, and we'll see everybody back tomorrow at the same time.
Thanks, you guys.
One union.
One union.
Thank you, everyone. See you tomorrow.
Bye, everybody.
Yep.
See ya.
Thank you.
See ya.